All right. Well, it's 11:01, so hopefully everyone who's joining us today has hopped on. We are here for a diabetes awareness webinar centered around what is diabetes. And today, Kim Beatty, who's a pharmacist and certified diabetes care and education specialist, who's been with Baylor Scott and White Health for 25 years and runs the Be Well with Diabetes program at Baylor Scott and White Health, will be sharing today's presentation with you. So without much further ado, I'm going to go ahead and hand it off to her.
Good morning, and thank you for the introduction, Rebecca. I wanted to thank everyone for joining this webinar today. As you may know, November is Diabetes Awareness Month, and I was asked to give this presentation to help people become more familiar with diabetes and its treatment. So let's get started with the objectives. First, we'll define diabetes, then we'll identify blood sugar goals. We'll talk about treatment with lifestyle modifications. We'll discuss diabetes complications, treatment of low blood sugar, and finish up with treatment with medications. So what is diabetes? It's a condition where the body cannot properly control blood sugar levels. So what does insulin have to do with blood sugar? Insulin is produced by the pancreas. You can see a picture of it here. It's a small organ sitting in the center of the body near the stomach and the liver. Insulin is responsible for moving sugar from the blood to other parts of the body to be converted into energy. There are several types of diabetes, but the most common three are type 1, where the pancreas makes little to no insulin. This is usually diagnosed in childhood. Type 2 is where the body does not respond to insulin properly or make enough insulin. Gestational diabetes is development of diabetes during pregnancy. Today, we're going to focus on type 2 diabetes because that's the most common type. It consists of about 90% of people with diabetes. We mentioned the body uses insulin to send sugar from the blood to organs and cells to convert it to energy. In type 2 diabetes, the body does not make enough insulin and or does not use it properly. This is usually diagnosed at a later age, and healthy eating and exercise can help control it, but often oral or injectable medications are prescribed. So what are the symptoms of diabetes? How would you know that you have diabetes? Well, you could have frequent urination, frequent thirst, feel hungry often, feel tired or fatigued, have blurry vision, or unintentional weight loss. The American Diabetes Association has set blood sugar goals for people with diabetes. Before meals, the goal should be 80 to 130, 1 to 2 hours after meals, less than 180, and the A1C should be less than 7%. This is your 3-month average of your blood sugars, and it's usually done by a lab test or finger stick in the office. If you do use a continuous glucose monitor, the time in range should be at least 70%. Now, the ADA has set these goals, but they've also made a statement that your goals should be individualized per your provider. So that's based on if you have complications from diabetes, your age, or episodes of low blood sugars. Bringing high blood sugars down into the goal range can improve those symptoms that we talked about earlier: frequent thirst, frequent urination, hunger, or blurry vision. But keeping blood sugars in the goal range for long periods of time can also help prevent some of the complications of diabetes, which we will talk about later in the presentation. The first way that we usually treat diabetes is lifestyle modifications. This consists of a healthy meal plan, physical activity, limiting alcohol, avoiding smoking, and having good mental health. So we'll first talk about a healthy meal plan. We're going to talk about 3 different meal plans that are most commonly used in people with diabetes. The first method is the plate method. It consists of using a 9-inch plate and having half the plate being non-starchy vegetables such as carrots, spinach, asparagus, green beans, broccoli, cabbage, cauliflower, onions, peppers, or lettuce. Then 1/4 of the plate should be a lean protein, such as chicken without the skin, fish, tofu, or eggs. The last fourth of the plate should be carbohydrates, such as whole grain breads, oats, brown or wild rice. And the drink should be either water or a low and 0-calorie drink. Mediterranean plate method is very similar. It just focuses a lot on fruits and vegetables and non-fat and low-fat dairy products. The last one we'll talk about is the DASH eating plan. It stands for Dietary Approach to Stop Hypertension, which is also called high blood pressure. It recommends to eat vegetables, fruits, whole grains, fat-free or low-fat dairy, fish, poultry, beans, nuts and seeds, and vegetable oils, and recommends to limit fatty meats, full-fat dairy, sugar-sweetened beverages, sweets, and maintain a low sodium intake. So we keep talking about carbohydrates. Let's talk about what they are. There are 3 types. Sugar is absorbed quickly and raises blood sugar quickly. Starch is considered complex and takes a little bit longer to digest. It raises the blood sugar more slowly. Fiber is not digestible and it doesn't raise the blood sugar. It also can help slow down overall digestion, which will delay other products from raising the blood sugar. So here's some examples of carbohydrates. As we mentioned, sugars can raise the blood sugar quickly. They can be naturally occurring, such as fruits, or added sugar, such as sweets or desserts, sugary beverages, and packaged foods. Starches can be starchy vegetables, such as corn, squash, plantains, and potatoes, or beans, lentils, and peas, grains, and foods made from wheat, such as oats, rice, barley. Fibers are the non-digestible plant products, such as beans and legumes, or fruits and vegetables, especially with skins that can be eaten, or those with seeds. So overall diet recommendations are to increase fruits and vegetables and whole grains, aim for low-fat or fat-free dairy, have good protein sources such as fish, poultry, beans, and nuts, and limit high saturated fats such as fatty meats like steak and pork, full-fat dairy products, coconut oils, palm kernel oils, and palm oils, and limit sugar-sweetened beverages and sweets. So now we'll talk about physical activity. The ADA recommends 150 minutes of moderate intensity physical activity per week with a minimum of 3 times a week. So this would be enough activity to breathe harder, raise the heart rate, and break a sweat. Examples of these would be brisk walking, biking, swimming, or mowing the lawn. As far as alcohol goes, it can lead to low blood sugar episodes or even delayed low blood sugar episodes. There's really no safe amount of alcohol to intake, so if you do not drink, do not start. If you do drink, limit it to the recommended amount. Women, 1 drink per day, and men, 1 to 2 drinks per day. 1 drink is considered 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of distilled spirits. Smoking increases the risk of heart disease, and that risk is even higher for someone who has diabetes. Nicotine can raise the blood sugar, and other chemicals in products make it harder for the body to regulate the blood sugar. It's always a good time to quit, and there's many people that can help, such as doctors, nurses, pharmacists, friends, and family. A few available strategies are to slowly decrease cigarette use, use nicotine gum, passage, or lozenges, or prescription medicines such as Chantix or bupropion. Mental health is important. Diabetes can take a toll on mental health. If that happens, it's important to find a mental health provider that can prescribe behavioral therapy or medication. Other ways to help with mental health can be exercise, sleep promoting routines, because good sleep is good for mental health, having proper nutrition, peer support groups, or mindful based stress reduction. So, we mentioned earlier the complications of uncontrolled diabetes. So, let's talk about what those can be. Microvascular complications affect the small blood vessels. A large amount of sugar in the blood can damage small vessels, and prevents nutrients from being delivered, which can cause damage. Retinopathy is damage to the vessels in the eyes. Neuropathy is damage to the nerves, typically in the feet, and nephropathy is damage to the kidneys. Macrovascular complications affect the large blood vessels. A buildup of plaque leading to hardening and narrowing of larger blood vessels, which cuts off blood flow to organs. This can be ischemic heart disease, which is decreased flow to the heart, cerebral vascular disease, decreased flow to the brain, or peripheral vascular disease, which is decreased blood flow to any other organ, not the heart or the brain. So, how do we prevent these complications from happening? Well, be sure to keep your annual checkups, eye, foot, PCP, and dental exams. Focus on keeping blood sugar in those target ranges that we discussed earlier, and treat other sources of complications such as high blood pressure and high cholesterol. Before we go over medications, it's important to talk about hypoglycemia. That's a condition that occurs when blood sugars are too low. It's typically related to diabetes and diagnosed with a blood test. Any blood sugar less than 70 is considered too low, and it can be raised back up by a fast-acting carbohydrate. There are a couple medications that can cause low blood sugars: glimepiride, glipizide, glyburide, or insulin. The symptoms that you're having a low blood sugar could be feeling shaky, having a fast heart rate, sweating, having a headache, or just confusion in general. So, how do we treat a low blood sugar? We use the rule of 15. Consume 15 grams of carbohydrates to raise the blood sugar and check it 15 minutes later. If it's still below 70, we want to repeat those steps. And we'll repeat them until the blood sugar is at least above 70. And then once it's there, you want to follow that up by a meal or a snack to keep it up. So here's some examples of 15 grams of carbohydrates. Glucose tablets or glucose gel. These can be found in the pharmacy where the diabetic supplies are. You would read the label for the instructions because they can vary by product. You could also drink a half a cup of juice or regular soda, not diet soda. Have 1 tablespoon of sugar, honey, or corn syrup, or use hard candy, jelly bean, or gumdrops, but see the food label for how many you would need to consume to get 15 grams. I'm going to discuss medications, just going over at a high level, pointing out some of the highlights of each of the medications in the different categories of groups. The first one is metformin. It's usually our first line of treatment when someone is diagnosed with diabetes. It's inexpensive and it works very well. We do see a potential for slight weight loss and a potential for benefits in heart disease. It's neutral for the kidney, but the kidneys have to function well to take it. It is known to cause diarrhea and stomach upset, so that's why we need to start at a low dose and increase it slowly. Typically, it does not cause low blood sugar. The next group of medications are glimepiride, glipizide, and glyburide. These are also inexpensive and work really well, but can be associated with weight gain and don't have any benefits for the heart or kidney. They are known for causing low blood sugar, so we need to start with a low dose, and glyburide cannot be taken with kidney disease. The next group is pioglitazone. It's a little more expensive and works intermediately. It's known to cause some weight gain and can have a risk of causing congestive heart failure. It's neutral to the kidneys, but like I said, we would not use it with congestive heart failure or someone who has fluid retention. Typically, it does not cause low blood sugars and could be beneficial in patients with liver disease or who've had a stroke. The next category contains Tradjenta, Onglyza, and Januvia, and these are more expensive and work intermediately. No weight gain or loss, and neutral to the heart and kidneys. We'd want to discontinue these medications if pancreatitis is suspected. They typically don't cause low blood sugars, but could be sometimes associated with joint pain. Next slide. The next group is the SGLT2 inhibitors containing Invokana, Farxiga, Jardiance, and Steglatro. And these are more expensive medications. They're pretty expensive. They work intermediate to high and can be associated with weight loss. Most of these have shown benefits with heart disease and kidney disease. They do need to be discontinued 3 to 4 days prior to surgery. They do have a risk of causing low blood pressure and can be associated with urinary tract infections. They typically do not cause low blood sugars. The next two categories are GLP-1s or the combination GLP-1-GIP. These contain Trulicity, Bydureon, Victoza, Ozempic, and Rybelsus. These are very expensive, but they work very well. They're associated with weight loss, and most of them are beneficial with heart and kidney disease. Now, they have shown a risk of thyroid tumors in rodents, so we don't use them in anyone with a risk of certain types of thyroid or who have had certain types of thyroid cancer. They do cause a lot of GI side effects, so we start at a low dose and increase gradually. We would want to discontinue these medications if pancreatitis is suspected, and they typically do not cause low blood sugars either. Mounjaro is that combination one. It has the same characteristics of the other GLP-1s, except for heart and kidney benefits are under investigation. There are a lot of different types of insulin. We have intermediate, short acting, premixed, rapid acting, long acting, and ultra long acting. The prices of insulin have come down in the last several years, but some of them can still be fairly expensive. Additional considerations with insulin can be that it can cause low blood sugars, injection site reactions, swelling of the hands and feet, but it does work very well, but can be associated with weight gain. It's important to take your medications just as your provider has prescribed them. If you don't take your medications correctly, then they won't work like they're supposed to work. So here's a few tools to help you take your medications correctly. You could get a printable medication chart, use a pill box, use a mobile app that will send a reminder, use an automatic pill dispenser, or set timers. So here are a couple of programs that the Baylor Scott and White Health Plan offers for people who have diabetes. BSW Be Well with Diabetes is available to large employer groups. So if you have your insurance through your employer, you should be, and greater than 50 members, you should be able to apply for this program. It offers $0 diabetes testing supplies, $0 copays for diabetic medications, one-to-one diabetes coaching, and a prescription review by a clinical pharmacist. BSW Diabetes Care Gold is available to Marketplace members. It offers $0 diabetic testing supplies and $0 for select diabetes medications, $0 for primary care visits, and individualized diabetes coaching. Condition management by case management is offered to all groups, and here is the email or call customer service if interested.
I do see it looks like somebody's got a question. I went ahead and unmuted you. Jimmy and Lori, do you want to ask your question?
Yes, hello. Can you hear me?
Yes.
Yes.
We have the silver plan. We don't have the gold. Of course, it's coming up to renewal time, but we have questions about how to get the diabetic, the glucose test strips and so forth.
Okay. I should have mentioned that gold plan is a new plan being offered starting January 1st. But yes, go ahead with your question about the testing supplies.
But I saw that with the gold plan that you can get the testing supplies for no charge. Is that correct?
Yeah, it would be a $0 copay.
And
Would still need to have a prescription sent in by your provider for both the strips and the supplies.
okay. All right. Thank you so much.
You're welcome.
You can unmute me now.
And I did see Robert messaged me directly to say shouldn't we avoid grains since they raise blood sugar? Um, and what would you say to that, Kim?
I would say that you can have them just at a limited amount. So follow your I did not go into carbohydrate counting because that was just more that we could conquer today. But follow your recommended carbohydrate level per meal.
Yep.
If you've seen a diabetes educator or a dietitian, they would be able to give you that information.
Yep. And as a registered dietitian, I would concur what Kim just said. That's heavily individualized as to, the medication you're on and how many servings of carbohydrates you can have in your meals and snacks. So definitely recommend following up with your provider if you have questions there and asking if you can get a referral to a dietitian if you want to go through that in greater detail, or for a CDCES. Many dietitians are all and pharmacists are also CDCESs, so either can help you with that. All right, well, I think that's the last question I saw. I'll do a quick peek at the participants again, just to see if I missed any hands up. And I don't, so I think we will end here. Thank you all for joining us, and thank you, Kim, for the lovely presentation.
Thank you. Bye.
Bye.